Most short-acting beta agonists come as a metered dose inhaler, and so it's very important when we're using a metered dose inhaler that we assess a patient's technique, because even with proper technique, this is a slightly poor delivery device, and only about 25% of the medicine will typically reach into the areas of the lungs where it matters the most. And so at every opportunity, whether you're dispensing a medication or following a patient for their respiratory management, you should assess their technique. Because what we find when we look at barriers to medication adherence is that poor technique tends to be one of the reasons why we see medications titrated up when there's really no necessity to titrate that medicine up. And instead, if proper technique was demonstrated by the patient, they would have been maintained on that original medication. For metered dose inhalers, each of them is going to have different types of priming guidelines when a patient first picks up the inhaler. And so in order to prime the metered dose inhaler, you typically do need to shake up each of these inhalers. There are a few where you don't need to shake, but in order to just avoid confusion for patients, it's a good idea just to teach them always to shake up the inhaler. And when you're initially using these medications, you will normally let out a few priming puffs from that inhaler. So if you notice that first puff, it didn't come out as strong as it should have compared to that second. And so that's just kind of priming that inhaler so that each time that patient takes the inhaler, they're getting the proper dose. Now, metered dose inhalers have been reformulated, and they now contain that CFC propellants. And with the CFC propellants, when you look at the plume of a CFC propellant is a widely dispersed plume. And so with these types of inhalers, it's very important that the patient either directly puts the inhaler in their mouth or that they use some sort of a spacer or holding chamber device when using the inhaler. And this makes sure that they're getting that proper dose of medication. Prior to the CFC propellant, it was suggested that you could use a two-finger method. However, because of that plume distribution, if a patient uses the two-finger method, they are not going to receive the right amount of medication. So the best way to use these is either directly in the mouth or with a spacer or holding chamber device. Breathing with these devices is extremely important. We want to maximize these medications into the chest. And so the best way to do this is to watch a patient demonstrate their inhaler technique. They need to make sure that when they're breathing in the medication, it's a slow, steady, deep inhale. If they are breathing in too hard or too shallow, the medication is not going to work as well as it should. And so to show you proper technique of a metered dose inhaler, the patient should make sure that they shake up the inhaler well, do a good priming breath for their lungs, so have them take a breath in, exhale from the inhaler, and when they're ready to take that second breath, they can insert the inhaler and then take a slow, steady breath in, like this. They should hold their breath for as long as comfortable and possible, but at the minimum, they should count for 10 seconds and then exhale slowly. Because the longer we can retain the medication in the lungs, the better that medication is going to work for the patient.